social services, folks in the Division of Medical Assistance, folks in the Controller's Office, folks in NC FAST, in collaboration with CMS to advocate for, document the need for, project, and finally receive approval for counties to receive 75% reimbursement for all eligibility functions for Medicaid, which would include the EIS. And we got it retroactive to June 1 of 2014. This will make a significant difference because we had counties were doing about 35% of their time in Medicaid, in EIS, in NC FAST, and about 65% of their time in EIS. So June 1, they're able to get a full 75% reimbursement for both EIS and NC FAST. And that is going forward because, as Angela was discussing, as we roll out the next phases of hard launch in NC FAST, counties will transition to where they'll be doing pretty much the entire volume of their work in the NC FAST system. And so we have 75% reimbursement to counties on an ongoing basis. Now, we are working with counties. Back in May, we requested that every county DSS create what we call an accelerated Medicaid processing plan. We call it an AMP plan, where they need to indicate, and they have, what they plan to do, how they plan to reinvest resources into getting the work done. And those have included comp time, overtime, and by the way, I think in the original reports, 98 of the 100 counties either were doing comp time and or overtime, some of them both. Probably all 100 ended up doing that. Bringing in temporary workers, bringing back retirees, particularly those who would know the EIS system, and we're still doing some work in there. Also contracting for agencies to get folks that can help in doing Medicaid work. Bringing on permanent staff, making organizational changes. We have had, particularly Sheila Platts here, the Division of Medical Assistance, and 9 others, have maintained weekly contact with many of our counties, particularly the larger ones, as we follow through and offer suggestions and recommendations to help them move those numbers of Medicaid applications overdue downward. All right. Going from here, we submitted a Deer County Director letter out to the counties. And what we're saying is we need to update our AMP plans based on the new 75% opportunity. And what we're saying to counties, and we sort of call it Big 7, the top 7 things that they need to do going forward and how those dollars need to be reinvested to do it. Number 1, maintain food nutrition service case processing requirements. We'll talk about that in a little bit. We're doing really good right now, but we can do better. Eliminate all untimely Medicaid applications. Eliminate all untimely Medicaid recertifications, both those that are being automatically extended a month, family children, or manually if they're not done by the counties. Successfully implement the next phases of hard launches scheduled in NC FAST that Angela talked about just a moment ago. Prepare for the November 15th, 2014 open enrollment period for healthcare.gov and the anticipated next wave of federal marketplace Medicaid applications coming to North Carolina. Preparation for full conversion to NC FAST with CMS waiver which we have for the man-child recertifications to be done in EIS, and that will end December 31. So that will be the ending of the opportunity to do research for family and children Medicaid and EIS, so all counties need to be in NC FAST and preparing to do that. And finally, and perhaps most importantly, achieve a sustainability plan. I mentioned overtime and comp time, and what we're saying to counties is you can work overtime and you can do comp time and you can work your folks 50 hours a week or whatever. You can do that short term. You can't make that your long-term plan. You will burn out your staff and you'll have FMLA, and we've seen that. So what we're saying, you have to have a sustainability plan for timely, accurate processing of all applications and recertifications for all programs, maintenance of quality customer service to recipients and applicants, and implementation of effective work support strategies, how to organize your work. Going back to what Mr. Cooper said a while ago, the business process of all of this and how to get the most productivity from staff. Finally, I would say that Another thing we've done is create what we call an operational support team. These are 24 folks who came from our different sections with expertise in Medicaid, food nutrition service, work first, child care subsidy, and other things, other programs. They've been trained, cross-trained. They've also received training on NC Fast, what we call a deep dive in NC Fast, as well as something we've come up with, and that is they have been trained and will be certified in the lean process in terms of business process redesign. They will be assigned to help and support counties. Our on-site support folks have been a tremendous help, particularly with training to counties, and I've had directors tell me we've improved our training to where it's much more effective going forward. But our operational support team members are going to be bringing to county DSSs not only policy knowledge, but also technical knowledge, and also knowledge in terms of how to design your organization. We've got counties that are also working to do some productivity studies, calculate the number of staff they need, look at their workflow, look at how they can better utilize their staff, look at what are the skills, knowledge, and abilities of the workforce of the future. All those things we're working on. So those are just a few of the things that we're doing, and I think we're continuing to have a lot of feedback, a lot of communication with counties.
Thanks, Wayne. So one of the things that I wanted to share as well with all of you today is some of the things that NC FAST program encounters, and this is all of the different communications around changes and system requirements. And I think sometimes we hear about these enhancements that are needed and different help desk tickets and where those are. So I think the key thing was to kind of show here all the different stakeholders that feed into some of these changes and system requirements. As I said before, we do have a lot of different changes that we get through our federal partners. We have state level requirements that change, but we also have defect fixes that we get in from our vendors. As we're working through defects, our NC FAST project team works on those that are identified. As I said before, we work with our counties to help prioritize any of those configuration changes that may be required. We have enhancement requests that come in. A lot of new enhancements we're getting from our counties that we're providing are some additional reporting that they feel that they need to be able to work the backlog, which once they're done with the backlog, some of those reports will no longer be needed. But we reached out and worked with them so that they could work efficiently in NC FAST and within EIS. So we created combined reports that they can work with. Other key things is looking at our help desk tickets and making sure that we're addressing those as we do our hard launch rollout. We are concentrating on any of those older tickets that are in those counties that we're targeting to work those down before we hard launch, so we continue to look at those. As I mentioned before, we have software upgrades that we get. We also get what we call iFixes. So those are fixes that layer on top of our new versions. So as you can see, it's a very complex process of maintaining changes, looking at system requirements, and ensuring that we're putting everything in and meeting the needs not only of the citizens and families of North Carolina, but assisting our counties as we move forward with them being able to administer those programs. This here is to kind of show where we have been and where we are today. I can actually say as of today, yesterday, we were able to get down below the 200,000 ticket rate due to some changes that we have put in recently that have allowed counties to move forward with some of their applications. We are targeting a 1,500 open ticket rate, which is historical for our legacy systems that we have replaced. But the key thing here is that as we move forward with our hard launch, we know that we'll have tickets that increase, and that's one of the reasons that we're trying to provide that additional support for our counties. Currently, we continue to work all tickets. This black line includes not only our Medicaid, food, nutrition services, and just general questions that we may get in from our county workers. So with that, I'm going to hand it back to Lynn.
Sure. Next slide we have looks at food nutrition services application processing status, and we like this chart. because this shows that our counties are maintaining their processing standards for food nutrition services applications. As I said before, we met both the February 10, March 31 deadlines. You can see from that point forward, there's about 741 untimely food nutrition services applications pending right now. That's out of something like 17,000 average pending at any given time. And there are legitimate reasons why an application could be pending that would be waiting information from the client. So that's also an issue there. Our next chart is food nutrition service recertification processing status. And here we do see sort of small spikes that take place at the beginning of each month. A little bit of an increase there. Most recently, we do note in the chart that Wake County had, and we've been working with USDA, by the way, in terms of reporting this information. Wake had some recertifications that were entered in their document management system, but had not been keyed into NC Fast, and we were required to count those as overdue. I'm happy to report we worked with Wake County, and they have confirmed that all of their apps and recertifications are now keyed in NC Fast. And even better, our latest information is they have really worked really hard on their recertifications, and they're down to only 65 that are overdue. And I think that was as of yesterday. So we're real proud of the work that they're doing there. The other thing is we do expect a bit of a spike in these numbers going forward. We're working with USDA in terms of the reporting requirements. And I think I may have reported on this before, but let me just repeat it a little bit. Persons that are up for recertification for food nutrition services, if they get their documentation in by the 15th of September, say, and their benefits would end in September, then information is in by the 15th. That recertification must be done by the end of September to be counted. Persons' benefits are loaded on their card between the 3rd and the 21st of the month on odd days. So, Ms. Jones gets her information in today, it's September the 9th. In that case, recertification should be done by the end of the month. Perhaps Ms. Jones gets her benefits loaded on the 15th. Well, on the 15th September, she's going to get her benefits. She's eligible now. Her recertification month is October, so her next benefits will be loaded on the 15th of October. On September 30th at 5 o'clock, the case is overdue. If the case is completed on October 1 through the 14th, Mrs. Jones gets her benefits October the 15th, and all is well for Mrs. Jones getting her benefits, so we don't have a complaint. But we have always had this policy. It's a USDA rule, and we've been accountable for it, and we are now, and that is that recertifications be done by the end of the month. What we now have with NC Fast, I think, is the advanced capability for reporting. And that is, we're able to track each one of those recertifications from the time they're keyed in, which is what I was talking about we need to have done, as it progresses along up until being approved. So we can now track the number that on October 1 would be overdue vis-a-vis USDA guidelines. So this is something we're working with USDA to communicate to them. Doesn't really change. I think basically we're in a good place with this. I'd like to share something else real quickly. In terms of our cumulative error rate for food nutrition services in North Carolina, through March of federal fiscal year, we're at 3.95%. The national average last year was 3.42%. So we're within about a half a percentage point of last year's national average for error rate. Now, last year in North Carolina, we were at 4.75%. But the two previous years, the national average was 3.8 each year, and in North Carolina, we were at 2.65 and 2.32. We are moving in the right direction in terms of reducing our error rate. And our goal is not to get to the national average. Our goal is to get back where we were and where we're going to be, and that is we're going to be excellent, we're going to excel. Again, just want to reiterate that counties are telling me, directors are telling me, And we've had a lot of communication, a lot of it's about Medicaid applications and the backlog. But what they're telling me usually is at the end of that conversation, oh, by the way, Food Nutrition Services and NC FAST is working well, is smooth. Our workers are doing well with it. I've heard folks say it's working like a sewing machine, so we're real proud of that. And let me introduce Sheila Platts from the Division of Medical Assistance for a Medicaid update.
Good afternoon, Sheila Platts, Assistant Director for Recipient and Provider Services. I've served in this capacity for 3.5 years here in North Carolina. I have 18 years experience total in Medicaid. Just to give you some high-level definitions of what we'll discuss this afternoon, healthcare.gov, which is the official name of the federal online portal, and the modified adjusted income, which is MAGI, we commonly speak of, which is under the Affordable Care Act. This is actually eligibility for those family and children's Medicaid and health choice, and this is a calculation that is used for determining Medicaid eligibility. And then we'll also talk about those traditional applications that are used to determine eligibility